So that next section, getting started, I might think, well, let me consider the patients that I failed to help and assess their characteristics and the diagnosis maybe that they had, and let me study on that topic and I'll be better. How's that faulty thinking?
It's just simply untrue. It's much harder than that. And what most people find out is disturbing enough once they begin to measure their performance, which is the first step. You have to measure. When we ask therapists, how effective are you? As I said, the average person says I'm better than 80%. I'm at the 80th percentile in terms of my clinical skills and performance relative to others. That's impossible.
Right.
Statistically, it's impossible. In one of the original article, they called it the Lake Wobegon effect, where everybody is above average. In fact, I think it was in the original study by Walfish in 2012, 25% of the sample thought they were at the 90th percentile. So why would you try to get better if you're at the 90th percentile? Instead, you're going to highlight what appear to be confirmation of your effectiveness rather than discrepancies, or the discrepancies are going to be attributed to chance or variables that are extra therapeutic that you don't have much control over. So really the first step is to get a baseline. How functional are your clients? And the two Danish physical therapists that I mentioned began using an outcome tool that we make available for free on my website called the Outcome Rating Scale. Because the point, I think, of physical therapy and psychotherapy is improved well-being. Regardless of an ache or pain, the question is, how do you function in your daily life, individually, relationally, socially, at work, etc.? So you could begin using, for example, that particular scale. And returning to my first point, you'll probably find something that is, well, it's discouraging, and I'll sometimes say that it proves that your mother was wrong. You're not special. You're simply not special. What most clinicians find out, much to their horror, is they're average, very average, solidly average. And by the way, nothing wrong with that. But once I know I'm average, then I can begin to look for, where do I fall short? So let me give you an example from my business. I don't know if it's true with chiropractors and physical therapists, but in general, mental health professionals have an average dropout rate. That is, people come and then they don't come back, of about 20%. There's lots of variability in there, but about 20%. That's low-hanging fruit. When you ask those clients why they dropped out, about half of them say, I didn't connect with the clinician, or I didn't feel like I was making progress sufficient enough to stick with it. Wow. That is something that I could deliberately practice, catching those clients sooner. Here's another interesting study. I'm trying to remember the researcher who did this. It'll come to me. They were looking at whether or not mental health professionals, and I'm going to assume it's the same amongst physical health providers, could identify their clients who were deteriorating while in their care. No better than chance. In fact, really worse than chance. So one thing that I can do to improve my engagement, keeping people in care long enough to help them, and then the outcome of that care, would be to be able to notice the ones that are actually getting worse and doing something different with that group. And these are just two examples of the many that would be possible when we begin to look at an individual therapist outcomes. It's entirely possible that a therapist we could find, their clients discontinue or deteriorate because their therapy lacks structure and focus. They can't figure out where the therapy is going. And that, as a coach, would lead me to examine, how do they structure their session, and do they need to add a more of a structure in terms of the model that they're using.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.